Hi everyone, and welcome to this week's lecture on sensory processing. Today we're going to talk a little bit about what sensory processing and sensory processing disorder are, and we're going to talk about how that relates to those on the autism spectrum. So first, let's talk about what sensory integration or sensory processing actually is. So these two terms are used pretty interchangeably. They do both refer to the same thing. They just kind of give a little bit of a different side of the same coin when you use the terms. When we're using these terms, we're talking about the neurological process of organizing sensory input through the seven senses. So all day long, we're walking through our world and receiving sensory input that's being processed in our brain. So you think about everything we're receiving for sensory information through our sense of smell and taste and sight and touch, and all of that information is going to our brains, and our brains are processing that information. When you use the term sensory integration, you're thinking also not only is your brain processing that information, but it's putting together a lot of different information at once. It's putting together the information that you're getting from your sense of touch with your sense of smell, with your sense of hearing. You'll note that I said there are seven senses, and when we talk about sensory processing, we add two additional senses to the five that we normally talk about. So the normal five senses: vision, auditory, tactile, taste, and smell. And then there are two other senses that we all have, but that we don't normally talk about. One of these is the vestibular sense, and your vestibular sense is based in your inner ear, and it's your sense of movement and balance. Okay, so things that involve, like the picture here, swinging or any type of movement through space in that way are going to affect your vestibular sense. A small child who spins around and around and around in a circle and makes themselves really dizzy has consciously affected their vestibular sense. And the other sense is the proprioception sense, and this is your body awareness. So this is a little bit different than touch. It's actually more of your sense of your body in space, your sense of how grounded are you, how connected are you to the place where you are at. Is it easy for you to feel kind of present in your body? Is it easy for you to feel as though you sort of have the weight of your body holding you in place, or is it really difficult for you to feel safe and secure where you are? That's your proprioception sense. What is sensory processing disorder? So this may or may not be a term that you're familiar with. A sensory processing disorder is considered difficulty in processing the information that is collected through any of the senses. It's considered to be a disorder when it impacts 2 to 3 senses and affects daily life. This disorder is somewhat disputed in the sense that it's not diagnosed in the same way that a lot of other mental disorders are diagnosed. It's still a little bit controversial in that sense. However, we don't really consider it to be anything that's significant until it is impacting a child in this way, where you're seeing them having difficulty processing information from multiple senses, and they're having difficulty conducting themselves appropriate in daily life. If we saw a child with an SPD, we would see things like poor academic skills, poor social interactions, poor self-care skills, poor motor skills, poor self-esteem, having difficulty kind of organizing the information from the world around you can have a lot of effects. What's important to know is that everyone who is on the autism spectrum has sensory processing challenges. So this is one of a kind of a common symptom that we see from people who are on the autism spectrum. You're going to see them having a lot of either over or under sensitivity to sensory information, and a lot of times this is one of the causes behind some of the atypical behaviors and symptoms that we see from people on the autism spectrum. This table on the slide here is something that you see in your Burren textbook, and I want to take a little bit of time to explain it and give you a few examples of some of the things that it's referring to. So it's important to remember that all sensory processing disorders include brain dysfunction of some type. So again, your brain is receiving information from your senses and it's processing that information. And what's going on with an SPD is that that information is not being processed in a way that we would expect in a typical way. So the brain is working in a different way than it would in a typical person. There are 4 different types of SPDs that we can talk about, and these different types are based on these 2 different ideas. They're based on the idea of self-regulation strategies, which are how your brain is understanding the information. and how it's actively or passively processing that information. And then the neurological threshold, how sensitive or how oversensitive or undersensitive your brain is. So you can have someone who has a passive self-regulation strategy, and what we would say of that person is they're receiving sensory input, but their brain is not being very active in processing this information. The brain is sort of sitting a little bit idly by. The person is not very aware of the information that they're receiving, and this is opposed to an active self-regulation strategy, where the person is much more aware of the information they're receiving and they're doing something about it. Okay, so keep those two terms in mind. And then we can talk about the two different types of neurological thresholds. We can talk about a high threshold and a low threshold. So someone with a high threshold can receive a lot of sensory input and still not be very affected compared to a typical person. As opposed to someone with a low threshold, they can receive a somewhat low amount of information and suddenly feel very affected. So what that looks like. Someone, for instance, with a low neurological threshold for sensory input, let's just say auditory, hearing sensory input for the sense of example, and an active self-regulation strategy, right? So they're very sensitive, but they know how to actively regulate this information they're getting. They're going to avoid auditory input. So loud noises occur, and this person is going to run. This person's going to hide. This person's going to cover their ears. As opposed to a person who might have a high neurological threshold for auditory information and still have that active self-regulation strategy. Now they're going to go looking for lots of auditory input. They're going to be seeking more and more input so that their brain feels activated. But if someone has a passive self-regulation strategy and a low neurological threshold, not only are they going to be overwhelmed by the auditory information that they're receiving, they're not going to know what to do about it. They're just going to become sort of you might kind of see them being really lackluster, really non-participatory, really withdrawn, because they simply just don't know how to respond to this information that they're receiving. And someone who has a high neurological threshold but is still passively regulating, you're just going to see them also sort of withdrawing in the sense that they're not being able to actively engage. How to actively engage with the world around them. They need more input, but they don't know how to get it. I want to take a minute just to talk about some examples of SPDs that you might see displayed among preschool children in the preschool population. This can happen in older or younger children as well, certainly. One thing that we see with children is a tactile avoidance, or you might call this tactile defensiveness. So these children are really sensitive to input from their touch sense. Think about it, when these children are receiving input from their brain related to the touch sense, their brain is really saying that's too much or that hurts. Things that are simple to us or things that are not painful to us may be painful to this child. So the child may be over-aroused or may respond to touch as if it were irritating or painful. And this might surprise us because the touch is not something we would assume could be irritating or painful. If this happens, a fight or flight response to the situation may be aroused, especially if that child is the active self-regulator, because they are going to do everything they can to avoid these uncomfortable touch sensations. Here are some red flags that you might see if a child is a tactile avoider. The child will probably seem overly sensitive to touch. The child may avoid messy experiences because they're uncomfortable. The child may be an extremely picky eater because those sensations inside his mouth are uncomfortable, may refuse to hold hands, may complain about socks or shoes or clothing tags being uncomfortable, not liking to be kissed or hugged, wants to stay very clean, washing hands right away. The child might appear stubborn or inflexible because he wants to avoid all of these sensations that are so uncomfortable for him. And the child may react to touch with inappropriate behavior such as hitting, biting, or kicking. So this is when it can become a real challenge in the classroom, or at home certainly. Some strategies that you could include to help children who have these sensory oversensitivities. You can prevent unexpected touches when possible. You can use a firm touch, because sometimes that really light, gentle touch, it can be especially irritating to a child. So make sure that the touch is one that just feels normal, I guess. You may want to only introduce one tactile input at a time, not asking children to experience lots of things at a sensory center, for instance, but helping them isolate one tactile input. You can try to make the external environment a little less stimulating for them, helping them to feel calm and secure. When you're introducing a messy activity, you might want to do things like explain what's going to happen, give the child permission to sit and watch, be patient with the child. Remember, even if this experience is not something that you would consider could be painful or uncomfortable, it may well be for the child. Excuse me. Here's another example of an SPD that you might be familiar with or you might have seen in children around you. We can have a child who is a vestibular, remember that's your movement sense, your sense of movement through space, a vestibular-seeking child. These are the children who crave excessive movement and balance input. So instead of the brain saying, that's too much, I'm on overload, here the brain is saying, give me more. What is normally enough kind of data for the brain to receive for a typical child is not enough for this child. So in order for the child's brain to comprehend that he is moving, he needs to take in a lot of intense vestibular movement. These are the children who don't get dizzy right away, right? So you might see children who can spin and spin and spin. These are the child who will go on the swing for what seems like hours on end because their brain really craves this input, and they'll do anything they can to get it. So that's why some of these red flags are things that you might see for a vestibular-seeking child. The child may be in a constant state of motion. The child may always be running instead of walking, be very impulsive. The child may participate in thrill-seeking behaviors or take a lot of safety risk. The child may be continually fidgeting, wiggling, rocking, squirming, even to the point of appearing to have ADHD. And that's what's important to remember with SPDs, is sometimes they can make us think of other types of disorders or challenges that a child might be experiencing. And I'll talk about that in just a minute, actually. If you have a child who you think needs extra vestibular sensory input, first you need to make sure that you're remembering to consider preschool development or the development of the children that you're working with, their age. Think about how long they really can be expected to sit and attend. Make sure that you prevent challenging behaviors as much as possible by offering movement activities throughout the day. So give these kids a chance to get the input that they need. And think about giving them various positions for learning, sitting on a pillow or a rocking chair, letting them stand, letting them give their brains some of that extra input that they need. Here's where I wanted to talk for a minute. So when you're seeing challenging behaviors or when you're wondering about what's causing challenging behaviors for a child, make sure you consider the sensory input. Is the child avoiding something? Is the child seeking something? What is the child telling you through his or her behavior? Is this child here really trying to make a big mess, or is this child just really trying to experience the pain as a full body experience, thus giving her the sensory input that she needs? Make sure you're sensory aware when you're addressing challenging behaviors. So you want to use sensory supports and respect the child's emotions. Try to be preventative when you're planning things for the children if you know they have a challenge with a certain sensory area. And be a researcher. Begin to document and look to see, is it really that this child is just off the wall and has ADHD, or is it that he's looking for a certain type of input at a certain time of the day every day? And what can you do about that? So we've spent some time talking about sensory processing in general today. And again, I want to remind you that people on the autism spectrum always have sensory challenges of some kind. They might be the couple of examples that we've talked about here today, or they might be something else. A lot of times, people with autism, we see things like sensitivity to light and sounds. And again, it's because their brain is processing that sensory input in a different way. One thing that's important to know is that there is therapy that can help with sensory processing challenges. It's typically called occupational therapy. It may also be called sensory integration therapy. New research is showing that sensory integration therapy is effective for children with autism spectrum disorder. There's an article posted on Blackboard that I would like you to read about it, and then I also wanted to share this quote with you to finish up today. So one of the researchers says, by changing how sensations are processed by the brain, and they're doing those changes through sensory integration therapy, we help children with autism make better sense of the information they receive and use it to better participate in everyday tasks. So this is really exciting and really critical. The rest of the slides that are part of this slideshow, take a look when you download the PowerPoint presentation. I'll just show you really quickly. There's some different resources, some links, some recommended readings if you'd like to learn more about sensory processing. Thanks, guys.